excited to be back with the second season of Saiton's Laser Chat, where aesthetic experts are getting together to talk about their individual approaches and techniques on a variety of cases with each other. Now, not surprisingly, as you'll see, on many cases, they'll agree on certain approaches, but not always. Today's experts, Dr. Liz Tanzi and Sherrif Ibrahim, are here to share their insights about the world of lasers.
Here we have our first patient, some photodamage on the chest. Pretty common type of patient that I see in my office all the time. So Dr. Ibrahim, what do you think? I mean, how would you approach this patient? Before I get to the point where I talk about what I did, let's see, you know, how you would approach this patient.
Definitely the first thing I notice about the patient is she's definitely got ethnic skin, and the décolleté in women of any skin type is definitely very sensitive. And this is an area where you do have to approach things so cautiously and carefully, and definitely less is more. 100% the first place I'm going to start is a BBL with this patient. And prior to having the BBL HERO, I would have used a standard BBL approach. Now that I do have my hands on the BBL HERO, that has really changed the game with the approach to these types of patients. You can deliver so many more passes at lower energy, but also that lower pulse width gets the energy in a little bit quicker, and you can do a quick treatment. I can't really tell from the image, but if she had some textural imperfections as well on top of it.
She does a little bit. She's got, you know, it's just, she complained of a little bit of, you know, kind of bumpy, rough skin too.
Then I would definitely do the BBL HERO first, bringing up that pigment. You can see it immediately. And then perhaps do a level 2 or 3 MOXI or a very low level halo on top of that.
And so let me show you the before and after. So you and I are lockstep in the approach to this patient. So again, she had some dyspigmentation. It was hard to see in the photos, but she had some tiny cherry angioma. And again, that kind of rough and bumpy skin. So first thing was a BBL treatment. And she had a HERO treatment, so the high energy rapid output device, which is great for non-facial areas because you can, again, put in a lot of energy without necessarily worrying about the stamping phenomenon. And I find it more comfortable than the previous stamping technique, at least on the body. We do it without anesthesia. And then we delivered a Moxie treatment, a 1927 nanometer wavelength right on top of that to help with texture. I like for the body, I like at least the level 3. I like a 15-15. So I usually do the manual mode. So I get 15 joules, 15% coverage at a minimum on the body. Sometimes I push it even higher to 20 and 20. Because I think you need to do that on the body to get a good resurfacing. And it's really well tolerated. Patients can certainly handle it. But yeah, the patient did really quite well. And you know, and as I'm using the HERO more and more, I find that I'm being a little bit more aggressive with it, particularly on the skin types 2s, 2, 3, because the energies are lower, so you can put in a lot more overall energy and still get a nice complement improvement. It's really quite nice.
Absolutely, I could not agree with you more. I mean, I've just been so impressed with just how the brown is targeted so well. With the traditional IPLs or the regular BBL, you would see the brown come up with a lot of red around it. With the BBL HERO, you're really delivering that energy specifically to the brown, and it's coming up so specifically compared to the background skin. And just like you said, you can really deliver a lot of energy. And that was a single treatment you did for her?
Yes, that was a single treatment.
Unbelievable. Really nice results. Okay, Liz, this is one of my patients I'd love to hear your opinion on. She's a landscaper, so outside all day, every day, and busy at the time of year she came to see me. So it made it clear she didn't want to have too long of downtime, just up to a few days, but not beyond that. So I'm curious to see what you would think.
This is my absolute favorite type of patient skin type 2 Photodamage, you know that we can really knock it out of the park with some of the Cyton technology. I would, and I have quite a few landscapers in my practice, so I know exactly what I would recommend for them. At least in DC, again, they're trying to not have too much downtime. I would talk to this patient about first doing a BBL, because that would help address some of her dyspigmentation lentiginous, some of the telangiectasia, followed immediately by full face or almost full face halo to clean up, and blend, but then perioral, potentially perioral and periocular if the patient wanted to, fully ablated or ablative erbium. So all of those on the same day. Tell the patient she'll probably have about 5 days where she can't wear makeup, 5 to 7 potentially, and usually by 7 they're all in makeup, but that's a reasonable recovery for these patients. And I think she would probably do, I'm sure that you're going to show me unbelievable after pictures, because these are the type of patients that usually do exceptionally well.
So for her, I did 2 sessions of BBL and just sort of 2 or 3 passes with the BBL on standard pigment settings, and then 2 aggressive halos. So for me, I love to turn up the halo. I think what it can do with a topical anesthetic in 4 to 5 days of downtime, there's nothing that can even come close with that. Sure, could we make more of a change with a full field erbium, but she's then 10 to 14 days until she reepithelializes. So for her, these are halo settings that I like to use in the 5 to 600 range on the 1470 diode at 30 to 35% density, and then really maxing out the ablative erbium that you add, because even at the highest setting of 100 microns, that's still fairly superficial, especially in fractionated mode. So I do 2 treatments and I space them out about 4 to 6 weeks apart. Without adding that BBL on, you'll still get that glow, that improvement in texture, but they'll still have brown spots and they'll focus in on the brown. So you really do need to add that BBL. And I always do the BBL first. I believe it just kind of brings the pigment up and then mow it off with the halo laser.
Yeah, I agree. I think that I almost never do a resurfacing treatment in my office, whether it be a lighter Moxie versus a stronger BBL or any of these treatments without doing BBL first, because there's actually a really decent paper written back in 2007 in derm surgery. Now they were doing a different IPL and a different resurfacing laser, but they showed that the results of those 2 treatment modalities was synergistic. And so since 2007, I've been doing that, and I truly believe it is synergistic. So I almost never do a resurfacing without a BBL before it, because I think that you just get so much better a result without increasing the downtime. But this is fantastic. I mean, that is really quite impressive for just halo. I have to say, my usual halo parameters are about 400 microns. And again, I have 400 microns, about 40% density, and then max out the ablative. And depending, I do under topical as well. Sometimes I'll talk to the patient if they're really sensitive to pain. We do a small amount of Demerol, but that means they need to have transportation home. But I think it's fantastic. I mean, that looks really quite good.
She was very happy. Just curious to hear, so if you were going to do a periocular, periorbital full field with the erbium, what would your settings be on that? Because for me, I like to go as deep as I can go, and that's definitely 10 to 14 days of downtime.
Right. Well, I'll usually around the mouth. It depends on the person, and I do work a lot with plastic surgeons who will do blepharoplasty and all of those things, and then send them back. They'll just do blepharoplasty because a lot of my patients are conservative, and then we concentrate more, not necessarily around the eyes, but a little bit more just around the mouth. And I'll go, depending on how thick I think the skin is, anywhere between 600 to 800 microns deep. I know that Jason Posner goes a little bit deeper than that, but that's where I feel comfortable. And then, just at the upper and lower lip with feathering out into the cosmetic unit on the cheeks. So, and then also feathering out even further into the halo treated area. So I think it's a little bit easier to heal when you're doing these smaller areas of full field resurfacing than doing a full face. Years ago, 20 years ago, I was doing full face CO2, and it was inevitably the jawline or some of these other areas that the skin's a little bit thinner that had, got the infection. Those were the areas of trouble. When you do just smaller areas, focal areas of fully ablative erbium, knock wood, I don't see that kind of issue. So usually they re-epithelialize in about 5 to 7 days and they can get back into makeup. It's not usually, for me anyway, going about 600 to 800 microns, it's not 2 weeks.
Yeah. And I've really done the same, focusing on smaller areas. You can just get the patient so much more comfortable with local anesthesia, and go really deep to the nasolabial folds, and then feathering out the radial cheek lines, and then haloing everywhere else. And there's really no line of demarcation that you can see once they feel.
Right. Fantastic. Okay, so here's a patient I had in my practice who was, her issues were, some mild discoloration, and she didn't like the texture, overall pores and texture of her skin. So how would you, Sherrif, how would you approach this patient?
Overall quality of her skin is very good. She doesn't have a lot of dyschromia. She doesn't have a lot of etched in lines. She just sort of has tired looking skin is the term that I use. Things that catch my eye that many other people are not treating are the reticular veins there on the temple. And the clear V is something that I've really enjoyed getting to these veins with that are just too deep for anything other than the 1064. But to just return this patient to the glow, to waken up her skin, liven up her skin, this to me is a home run for the halo. You could consider Moxie depending on how much downtime she wants to have. I think the Moxie is definitely an easier treatment for the patients to go through, and even on a level 3 or the highest settings, they don't really have too much in the way of downtime or swelling. And if she wanted just a little bit more correction, even some tightening, I would then go with a higher level halo treatment. I would also probably let her know ahead of time that she would be better off with maybe 2 sessions of the treatment to really get to her endpoint.
Okay, so let's see before and after. So she was a patient that she was, a little nervous, and she didn't want to have the downtime of the halo, even though it's not particularly terrible. So we did Moxie on her. And knowing that she wanted to get some improvement relatively quickly. The first treatment, actually this is a single treatment. She has since been back to my office to do a second go around. But this was a single treatment with the Moxie. So a level 3, or like I said, we do manual. So it was 15 millijoules, 15% coverage. And I like it. I like it for skin type 3 a lot. I think it does a really good job. I've used it quite frequently. We do a treatment, and then about 4 to 6 weeks later, the patients can come back for their next treatment. And, knock wood, I haven't seen any PIH. I haven't seen anything. And we're relatively aggressive with these patients. Now we're starting to do more patients at 20 millijoules and 20% coverage. Patients are pink. There's no doubt about it. They may have a little bit of swelling under the eyes for a day or so, and then they have all that really beautiful peppering. But the whole recovery process is easy in that you can cover it with makeup right away, and it's all the microscopic epidermal necrotic debris, all that peppering will fall off in 4 to 5 days. So it's definitely a tolerable treatment. I like it a lot.
It's so easy. I cannot believe how I've just been so impressed with the Moxie. It's even at the highest settings, you do get the mends, the little crusty peelies, but they're smaller than they are with the halo. And people can cover them up pretty easily, and people are just so happy. They just keep coming back for more treatments.
Right. I agree. It's like a happy laser. It really is. Patients like, wow, people are telling me, my skin looks really good, and what I've been doing, there's just something about the luminosity of the skin after having a 1927 treatment. It's lovely. It's like the halo glow, but you can see it with the 1927 too. It's really quite nice.
Absolutely. I'm so happy to have it. Great results, even just with one treatment. Liz, this is my next patient here. She's definitely a young patient, frustrated with pigment that is more than just solar damage, definitely some deeper component, maybe some melasma. And we see this on the lateral forehead of these younger women a lot. She had BBL with me, and it browns up with the BBL treatment, but BBL alone isn't enough. So curious to see how you would approach this patient.
Well, so I agree with you. There definitely looks like there's potentially some melasma going on here, and after taking a look at the patient with the Woods light, that would give us some idea of the depth of this pigmentation. I've been really impressed with just the simple 1927 wavelength, so Moxie potentially, but if I did think it was a melasma issue, I would probably be less aggressive with my Moxie and talk about more treatments rather than less. So maybe doing 10 millijoules and 10% coverage, and do a series of treatments about maybe 4 to 6 weeks apart, and potentially add some at-home triluma, the hydroquinone, if the patient could tolerate it, and try to sneak up on the melasma that way.
What I did though with her is, she came along right when I got the BBL HERO, and I tried it with the small square handpiece on her forehead. So much lower energy, but I was able to, much less energy per pulse, but was able to do multiple passes right over the pigmentation.
Really?
And then did Moxie right away afterwards at a level 2, just like you said, at the 10 joules.
So with the Halo, with the HERO treatment, did you use a 560 filter or a 515 or both?
I used the 515 filter for her.
Interesting.
Pigment filter, browned it up so well, and then did the Moxie right over that. And this is after 3 treatments. But
wow.
We know that the rule, the name of the game with melasma is that it's going to come back, no matter what it is. And so I think with Halo, you can get improvement with deeper pigment, but the patients feel frustrated because they spent a lot of money, they spent some downtime. It's a little more involved to get a Halo.
Right.
Now we finally have this treatment that they can come in and get quarterly, or even more frequently. Once you've done a series of treatments, they're happy to come back for additional Moxie treatments. So for me, I'm so satisfied to finally have something to offer these patients. It's difficult pigment. You can even see it on the before picture there on her, her zygoma below, but really just beautiful result. And all they want is to be able to cover it up with makeup, and they're happy. So she was really ecstatic with this.
What's nice too, you mentioned, having the patients come back on a regular basis. I mean, we have good science to show that these treatments, these smaller laser and light-based treatments on a regular basis help to stimulate the skin. So they're anti-aging too. So she's doing something that's good for her skin, not just controlling her melasma. So I think it's really nice to be able to offer that, because you're not just treating her forehead, you're treating her full face. And that's great. She's doing something that is actually anti-aging, which is good.
And it's harder to convince someone to come in for a Halo 4 times a year, but it's not for a BBL, and now not with a Moxie. They just, like you said, it's the happy laser. They just love it.
Right. It's a happy laser. It's happy for the docs and it's happy for the patients. Okay, so I don't know if you treat a lot of bodies, but I have a lot of patients who come in originally for their face, and they do really well on their face, but then they start to look down and say, you know what, I have a lot of photo damage on the rest of me, so what can I do? How would you approach?
These patients are tricky because I think there's 2 components going on here. You definitely have solar lentiginase and that sort of background pigment, but there are also some macular seborrheic keratoses. They're kind of in the middle on the ulnar side of her forearm, and those can be really tough. And those are the ones that catch the patient's eyes more than the background faint brown. So, certainly BBL is going to be combined with whatever modality you choose to use beyond that. Prior to BBL HERO, you would have to use a very, very conservative BBL. Otherwise, you'll get stamping on the forearms. And that's just almost always happens unless you're at very, very, very low energy. So with the BBL HERO, if I had my choice of anything, that's where I would start. Starting at about 5 joules, I think would be plenty at the 3 millisecond pulse width. And just kind of gently going back and forth, almost like a little magic wand. You may or may not get improvement in those macular SKs. And really, if you want to get those totally gone, you might have to come in with the erbium single spot handpiece at a very, very superficial depth and just erase them with very, very superficial ablation.
Okay, so let's see before and after. So yeah, again, it's because there's so much going on with these patients. There are lentiginous, but there are macular septs. There is, they oftentimes also have some, guttate hypomelanosis, which we have to talk about because anything that we do is not necessarily going to address that clearly. We're just going to even it out. And it's not unusual. It's hard to tell from the photo, but oftentimes patients are complaining of, my skin is just kind of crepey and I don't like it very much. So a textural change. So again, I often like to treat these patients now, thankfully with the Hero, because as you say, it's just kind of that gliding BBL is just a beautiful thing. It's just not as uncomfortable. I think it delivers a better result and a more even result. And it's arguably not that much quicker than the stamping because you're putting in a lot of energy and we're doing different wavelengths. But I think the results are so much better. And then we'll follow it up immediately with a 1927 with a Moxie, and usually we'll be treating as high as we can with the Moxie, so 20 millijoules and 20% coverage. Patients have maybe 2 to 3 weeks of what just looks and feels a little, it looks like sandpaper. It feels, it feels like sandpaper. It looks a little dirty, but it's not really obvious downtime. And I agree, we have to focus on those macular septs somehow. We can go in with an erbium, you can go in with a simple, electrodesiccation or cryo. But I usually like to clear them out first. So we do the treatment, then we wait 2 to 3 months, come back and see me, and let's see what's left behind. Other times, again, I just may go in and spot treat what is left over now and taking a look in those areas. And patients usually do pretty well.
Yeah, I like a couple of things you've said, definitely. I definitely do any kind of ablation first, because then if you're going to do either Moxie or Halo over that, you want to improve any kind of pigmentary anomalies that you've left behind from either, from your ablation. I do find that the single spot handpiece, it's less of a chance of the hypopigmentation that you might get with some cryo. If you're just so much more precise with the erbium than with cryo. And another thing that you said I really like is that the Hero to me is not about speed. I mean, you can do a quick treatment with a traditional BBL. The Hero it's a better treatment. I mean, with BBL Hero, you can get more energy in such a safer way and just get better results. And the patients are so much more comfortable, particularly on the face. So Liz, here, this is a tough patient, and definitely a patient that said she didn't want too much in the way of downtime. And as we know, acne scars are one of the hardest things that we treat, but can potentially be one of the most rewarding things that we can treat when it goes well. Didn't really have a high pain tolerance. She's very young. And definitely has some pigment to her skin at baseline. So curious to hear your thoughts on this.
Oh boy. I have to admit, with atrophic acne scars, I like a lot of RF microneedling nowadays. I'm not sure this patient will be able to handle that though, because it is pretty uncomfortable.
So this is a patient that, I would consider doing a deep fractional treatment with, or even a full field ablation, but she made it clear she didn't want any injections. And so that makes it really difficult. So I said, we can try one other thing that may or may not work. And for her,
wow.
All right, so this is Halo alone, 2 sessions of Halo alone. Really at maximal settings. So at 700 on the 1470 and then 40% density. You can't really go too high on the 2940 once you've got that much energy going into the 14. Right. But I think she had maybe 20 or 30 microns of ablation. I was blown away. It was kind of, let's try this. Let's see what the Halo can do. And since then, Halo has really become one of my go-to treatments for this atrophic acne scarring.
You said that was about 700 microns on the 1470.
Right. Maximum.
Maybe you've hit the sweet spot within the dermis of exactly where her scars were. That is really quite impressive.
The other dual wavelength lasers out there are either a little too deep or a little too superficial.
Right.
2 to 700 wave range in depth and microns that the Halo offers. For me, it is, I don't even use the fractional for my acne scar patients at all. And we just, we're publishing a series of these patients treated with Halo alone, not even with BBL.
Nice.
With a topical anesthetic, a lot of edema. You have to get ready to get them through that. But even at maximal settings by day 5, they're glowing.
Right. So that's the swelling, the 2 to 3 days of swelling, I think patients would be willing to accept with results like this. I'm really looking forward to seeing that manuscript. That's good.
I would give it a try. I mean, I've been really, really impressed.
I like it.
And no hyperpigmentation in this patient too. That was definitely a concern.
Thanks for watching another episode of LaserChat. Here at Sciton, we are proud to partner with leading practitioners in medical aesthetics who are willing to share their clinical expertise so that you too can achieve stunning before and after transformations in your own practice. Make sure that you give us a thumbs up and subscribe to our channel to make sure that you don't miss any other episodes. And if you want some more technique tips or treatments or before and afters, please like us on Instagram and Facebook. I'm John Hammerly. We'll see you again on LaserChat.